Studies tend to be more accurate when observed with a larger sample size. Each day there are around 40,000 Google searches every second, so these queries can be a great inexpensive source of data to predict many different health concerns in order to intervene them from occurring. This week's topic focuses on using this data to predict the trends related to heroin use. It's important to predict this trend because there has been a great increase in death related to heroin use since the year 2000. During the study, they discovered that people in different areas use different keywords to search for opioids such as brown sugar and China white. The model created from this study was able to explain 3/4 of the outliers in heroin-related emergency department visits. However, there are several aspects that need to be fixed for a more accurate result from this study. First is that this study took place with the assumption that all Americans use Google over other search engines. Second is that they omitted the importance of context and solely focused on the keywords. Last is that they did not remove unrelated data for searches meant for other meaning associated with the keywords. Once these issues are considered in the future studies, they will be able to provide a more accurate and valuable prediction for heroin use trends.
The data collected from EHRs has the potential to allow for more accurate diagnoses and effective treatments by doctors. With so much data that is collected and used from EHRs, the data is commonly referred to as big data. This big data is classified in 3 ways: volume, velocity, and variety. It can be more accurately translated to copious amounts of data easily and rapidly accessible for capture, diverse types of data, and heterogeneous patient data that has not been previously available for analysis. With this new frontier of big data in such a vast quantity, it is allowing for new models of analysis, surpassing traditional outdated models of analysis. One of these new methods of analysis is called predictive analysis, which use a coalesce of capabilities and powers of machine learning and artificial intelligence. Predictive analysis is a new electronic algorithm that is meant to utilize data from EHRs to help make clinical decisions, forecast future events, and help doctors make decisions in real times. As I conducted this reading, I think it's important to realize that doctors should not use just predictive analysis solely. They should also use their intuition and give certain scrutinization to the predictive analysis, because depending on the model that was created, there will be different stakeholders will have different values. There might be conflicts of interest depending on the variables used. And they got to make sure that the data pool they collected was of actual statistical significance, and that there was an appropriate amount of patients, and that the model couldn't be skewed in any way. But it's important that doctors should not just use only one method, but multiple when providing healthcare, and it should be a shared decision to make sure that you identify and advocate for what is best for the patient.
In class, we discussed issues like mental health within the context of data aggregation and analysis. It was interesting to see the ways in which mental health infrastructure is currently quite limited, not just by understaffing and lack of funding, but also how difficult it is to understand a patient's needs. Additionally, even with mental health services having proper funding or having the necessary means of understanding a person's needs, it is often difficult for people to even know that they need some sort of help, and this can be seen in people who have posted things online in reference to stress, anxiety, feelings of hopelessness, feelings of depression, and those people often fall through the cracks of our mental health system. So perhaps there are algorithms or reporting methods that can be created that can help people be safely monitored within their known consent, and that could help people who fall through the cracks or people who need better understanding from their counselors and from psychologists and psychiatrists, etc. So perhaps if we were able to do this sort of monitoring, we would be more able to help those struggling with their mental health issues.